Okay. Okay, Mayor, you're good to go. Thank you.
Okay, very good. It's 10 o'clock and I'll call the meeting to order. And as previously mentioned, but I'll mention it on live stream, Councillor Simpson is unable to attend today due to the passing of a family member. And so our thoughts and prayers and condolences go out to the Simpson family in this time of their sorrow. So all the best to Brianne and Roger and the family. The first item of business is to inquire if there's any conflicts of interest on today's agenda. Indicate if there are any. I don't believe this should give rise to any conflicts. So the record will indicate no pecuniary or conflict of interest. Next order of business is a motion to adopt agenda for today's special council meeting. So who would care to make that motion? Okay, Councillor Chapman moves the adoption of the agenda of today's meeting as circulated. All in favor? Okay, and that's carried unanimously by the members of council present. I want to thank the members of council for taking time to attend today's meeting. I know it's a little bit of an inconvenience, but something to be dealt with expediently so we can have clarity on how we operate our facility. So I will turn the meeting over to Russ, I guess. Is Russ going to present, or Kaylin, do you want to introduce it? Russ?
Okay. Thank you, Your Worship, and through the Chair to Mayor and Council. Thank you for your time. As you're aware, the province came out with some new restrictions and guidelines on Wednesday, and we've been deciphering them and in communication with other communities. I guess what I'll go through first is just the two options that they've laid out in operation of facilities and activities. Activities is kind of a word they are now using that's showing up more in the document today than it was even on Wednesday, as it adapted a little bit. But so in order to do activities within these facilities, and I'll just leave it specific to ours, for the most part, we're dealing with ICE users and rentals for some of the other community facilities like the community center and Gem of the West Museum. So there are two options. The first option is to implement the restrictions exemption program. It's already being billed as the REP program throughout, but requiring proof of vaccination for negative rapid testing. So in this option, it would allow facilities to operate much the same as what we were last week. But what it would require is that proof of a second dose of vaccination be handled by an individual participating or entering into the facility, documentation of medical exemption, and or the first vaccination within 2 weeks of the activity as well, and or a negative test done 72 hours prior to, within the 72 hours prior to the activity, by a private firm, not by Alberta Health Services. So they'll have to pay to do that. So that's the option one that would require that. And option two being the follow capacity and operation restrictions as outlined in the program, keeping in mind that really option two doesn't allow adult activity in sport and recreation. There is a sport and recreation section within the order that still allows kids under the age of 18 and above the age of 12, because keep in mind, under the age of 12 is not relevant in this in terms of vaccination, but between the ages of 12 and 17 would allow sport activity, very similar to the end of last year, where there's 1/3 capacity for facilities. There's social distancing upon entry of the building with masks until in the activity themselves. And then the youth of those ages could take off their masks. So those are the two options. And to tell you the truth, prior to a maybe discussion on those two options, it's probably important that I provide for you a little bit more of a development, almost a third option. It's not really a third option, but it's working within those two options to a hybrid model. Because they're talking about activities now and not facilities, I think at first glance, a lot of communities were looking at this and suggesting that facilities need to determine whether or not they're going to do the exemption program or whether they weren't going to, and then people would fall within suit. And the reality of it is that's not the case, and nowhere does it say that. It actually applies it to each activity. And I can confirm that there are communities around us that are already acting upon and presenting and planning more of a hybrid approach. And so what I'd like to do is kind of share my screen right now and show you an approach that would mesh the two options together and allow user groups or program providers the ability to decide which option works best for their program. So I'm just going to share my screen here. Make sure I pick the right one. All right, are you guys seeing this?
Yep, I can see it.
Okay, let me just, there we go. All right, and so what you're seeing here is the hybrid option, an approach that allows programs to choose their own. The possible landscape in this case would be, and what we're suggesting is that we talk to our participants and user groups and program providers to talk and deal with which option works best for them. This would then in essence allow adult programming, if we went this route, to take place, but obviously within option number one. So the landscape could look like this if this is direction one. Option number one, participants could look like adult hockey. So we have adult hockey groups that book our facility on a pretty regular basis, up to 6 times a week. Very, and so they're there pretty consistently. And so if they wanted to operate, they could choose option one, and we could make sure that the proper documentation and things were in place either ahead of time and or checked at the door prior to entering into the facility. The Junior B Hockey Club, and I want to say this with caution because the Copperheads are waiting for further direction from the Junior B League. For instance, I can give you an example. The Junior A Hockey League in Alberta has already come out and said that they are doing their own immunization exempt program within their league to operate at their facilities within their communities, regardless of whether the communities are choosing to do that on their own. That's what their league is doing to continue on. I don't know that the Junior B has the same types of resources as the Junior A will have, and so I don't know what route they'll take, but I know they're waiting for further direction from their league. But they are 18. They have players that are 18 and older, almost all of them. So, well, all of them. And then we have our public skate, which is a public program. However, it's not one-on-one direction. It doesn't fall within the option 2 requirements, and so we would, likely have to look at that as an immunization exempt, or we would have to really enforce the social distancing and masking and 1/3 exemption. So there's a couple ways that we can deal with that. It'd be easier to deal with at the door, the requirement, in my opinion, but that's where that's at. And then facility rentals. And I put facility rentals in this category because most often our facility rentals are dealing with some adults. We have the cribbage group and people like that, and they could still operate if they chose to operate within these parameters of option 1. And then as we go down to option 2, the landscape could certainly, and I can tell you, I did talk to minor hockey today, so this information is real. Talked to them yesterday and today. Things have changed and developed over the last 24 hours as they've also been provided feedback from their own user groups. But I talked to the president today, and he suggested that they would prefer to stay within the option 2 and deal with the restrictions of 1/3, deal with social distancing coming into the building, masks worn up until the activity, because they are very concerned that they would lose volunteers, coaches, and participants if they were to go to option number 1. And they operated under very similar circumstances last year for portions of the year where they were open. And so they're prepared to do that. Coaldale Figure Skate, I haven't been able to make a connection with their president quite yet, but it's safe to assume that the vast majority of their participants are under the age of 18 and that they'd fall in the similar category. United Hockey, I was able to talk to Wade Klippenstein, and he made me aware that even the vast majority of his program participants are actually under the age of 12, which are exempt from the whole program. And he'd be able to accommodate all the other expectations under this option. So if council were to look at the ability to go with a hybrid approach, or an approach where we'd work with each user group, administration would work closely with them to try to eliminate as many barriers as we could to provide these programs. And I also wanted to note that should council go with this option, knowing that the landscape changes and changed multiple times last year, there's a possibility, obviously depending on what the changes are, but there's a possibility this will allow the most adaptable approach for us to work with each user group as they move. For instance, say minor hockey got to a stage halfway through the season where they decided, you know what, we want to implement that program, the immunization, because more of the provinces to that point. I'm also assuming that certain communities and programs that decide to go the other route won't be crossover and playing very often. So, but if anybody were ever change their mind on something, we wouldn't be having to come back to council for approval or things like that. This would provide administration user groups the ability to work with each other. But that's all I have for my presentation. Unless, are there any questions?
Okay, I'll open the floor up to council for questions of Russ. Councillor Holm.
Thank you, Your Worship. I'm just wondering also about the curling club. We're wondering about what happens with the Gem of the West Museum and other facilities like that, because I know the curling club would be considered the recreation side.
Yeah. So through the chair to Councillor Holm, the curling club would again within this parameter would need to look at their business and their operations. Unfortunately, I don't know it as well as they do, and then either require the proper documentation to follow step one. And actually, I think that they're probably following under that until things change, because well, I'm sure they do have some youth programs as well that they could operate. So I haven't heard from them yet. They're not in operation yet. I don't even know that their manager's in place yet, but they don't start operation till October. So, but it's a really good question. Gemma West Museum and everybody else, they'd fall under that facility rentals category, and or attendance, right, category where they'd be restricted to the restrictions if they chose not to do the immunization, which I would imagine an operation like Gem of the West would continue to just operate under the current restrictions. So one-on-one showing through the museum, things like that. So.
Councillor Avery.
Thank you. So thanks, Russ, for the presentation. And it's good that we're looking at the rec facilities, but what about all town facilities? And we talk about the user groups and putting restrictions in, or a hybrid system. What about our town staff? Like, will the workers need to prove that that they've been vaccinated? The town office, the same thing, because if we're going to implement this at a user level, what about at the employee level?
Kalen.
Through the chair to Councillor Avery, excellent question. We had a meeting with senior management officials yesterday, and we are looking at different options that are available to us, and currently working with legal counsel on a policy implementation framework for that very thing. We don't have the full details worked out for rollout, but we are discussing it, and we are consulting with experts on the most pragmatic way to go about that to ensure that we do have a safe workplace, balancing all of the other considerations that go along with this matter. So I'm happy to provide an update at a later date, but we are working on this as we speak.
Okay, Russ?
Thanks for weighing in there, Kaylin. And just from the recreation aspect, which is the only one that I'll direct and speak to, is if we went with the hybrid approach and there were program providers that were taking the exempt program and requiring that, we do know that we have staff capable of being scheduled during those events to be able to fall within those parameters.
Okay, and so just to clarify, this policy is looking at, town facilities in the recreational aspect of and culture recreational aspect of things. So is by implication it be the sports flats, the Granite Club, and the Gem of the West, and the community center. And so that I really like the idea that we're looking at the hybrid solution and, having the latitude to properly adjust so that we can not have our sports flats have to be empty or something, especially after we did a marvelous job of renovating and improving that facility. So, Councillor Chapman, you had a question?
Yeah, thank you so much, Your Worship, and Russ and Kaylin, thanks so much for digging into this issue and bringing it forward to us. I know that this is becoming another difficult time, and I wanted to ask about the library because they're having their board meeting this evening as an emergency meeting to understand the next steps. I just wondered if the library fell under the town's jurisdiction, or if they have their own protocols that they would be following. I'm sort of sensing from Councillor Holmes' question about the museum and the curling club that some of these have their own protocols, being even though they are town-owned facilities. So I just wanted to get clarity for our board tonight. Or for the library board tonight. And the other thing I wanted to ask Russ about, FCSS has already reestablished a lot of their protocols from prior times and have taken this process very, very seriously. So their staff are, my understanding is their staff will need to have some kind of form of proof of vaccination for starters. The one other big takeaway from the notes that I read was that vehicles are going to be an issue there, mainly because they will insist, the FCSS will insist that all their vehicles be disinfected and sanitized prior and after every use. And if a person doesn't feel comfortable, that they use their own vehicle, but that's in their realm of work. So I don't know if the town is going to be, looking at some of their stuff like Jason Avery is asking about for our town employees. So those are my basic questions to you, Russ.
So just to kind of clarify what the question is.
So the question is about the library and whether they fall under your jurisdiction for these protocols, or do they establish their own?
So Kaylin is going to take that one.
Okay. Go ahead, Kaylin.
To Councillor Chapman. Thanks, Russ. I put my hand up because I just had a conversation with our librarian yesterday in preparation for her special board meeting. It would be within the sphere of jurisdiction of the library board and that facility on which of the options that they develop, be that option 1, 2, or some form of a hybrid. They also have as an additional option for their type of work, curbside pickup service. And that's something that they've been offering for the last while and something that they can continue to offer, notwithstanding the option that they select for moving forward. So they are having a board meeting to discuss this, and that would be within the governmental jurisdiction of the library board, how they decide to implement any changes to their facility.
Okay, so Russ, I just wonder when I look through this, if we do happen to adopt the hybrid model, would you operate, this might be operational, but would there be a sort of a window between groups and that? Because, if you can't necessarily merge option number 1 and option number 2 on the head, within a 5-minute, you need a certain amount of time to turn around the different groups and the sports flats, I would think. So is that part of your operational plan that you're going to do too?
Yeah, thank you, Your Worship. Great question. And yes, if a group is coming in and taking the option 1, the immunization, then we will definitely make sure that the building's cleared out and that's followed to a T. We've done that in the past because some of the restrictions that took place last year actually required us to, between each cohort, do that. So we are well prepared and equipped to be able to do that. That's what we'd look at this point in time, and wait for the bookings to come in and which options they're doing, and then look at the timeframes in between. Because of the nature of ice use, there already is timeframes between the bookings, even if they stay within the option 2, and capacities of the facility will easily be kept for the most part. Not for the most part. I said for the most part only because if the Copperheads do operate their program and get the exemption, then there would be more than 177. So according to fire code, 1/3, our capacity will be 177, which for minor hockey isn't a problem.
And then just finally, all this stuff does cause a certain amount of scrutiny at the door and whatnot. And I'm interested to know how the policing, if you want to use, for lack of a different word, of this thing, does that responsibility fall onto the specific user group, or are we putting a town employee in the front of this thing and exposing them to the wrath of people that don't necessarily agree with whatever we're doing?
Well, another great question. And another reason why I really like this hybrid approach is by putting it back on the user group and suggesting that, hey, what option are you taking? It allows us to have that connection right up front and be able to work with them on how to implement the system. But we will certainly make sure our staff have the resources they require to be able to work through those issues that might arise, which are likely to arise from time to time. But this is why I like this approach too. It's not the town saying, hey, as a facility as a whole, we're going to implement this program and we expect everybody to do so, because then it really would be on us to enforce that. In this case, I would suggest that it'd be a collaboration of the user group and ourselves. So
I see Councillor Holman has a question, but I just, in the face of all this stuff, I guess it would be important to have proper notification at our facilities. There's a zero tolerance for abuse within these facilities, so we enforce the fact that whoever's conducting and allowing participants in that, they have that background and backup that they know that we're not going to tolerate any abuse of anybody that's trying to do a good job of allowing people to use the facilities, and it's whether people are in favor or not in favor of certain elements of the current environment, the public health crisis that we're under. Council's neither endorsing nor condemning any of the things. We're just working with the rules or regulations that are passed down to us by a senior level of government and trying to make the best of a bad situation. So go ahead, Councillor Holm.
Thank you, Worship. I'm going to speak against option 2 and the combined group. I believe we need to go with option 1, which forces if we're going to get out of this situation, I think we have to take the hard line and ensure that our facilities are used by people that are vaccinated or that they pay for themselves to show that they are clear of this. The reason I'm really strongly in favor of option one is I went to a rodeo in Tabor last week. And when we pulled up to the gate to pay, they handed you a bottle of water because in their mind, they said, we don't have to abide by the restrictions of a mask and everything if you've got a bottle of water, because if you're eating or drinking, you don't have to wear masks and you don't have to do anything. So there's loopholes in this that I believe our community groups will find the loopholes, and we're going to be in this situation for much longer than we want. So I'm totally in favor of option one of the vaccination side and sticking it with it for all facilities, and if we need to, with all of our staff as well.
Councillor White?
Thank you, Your Worship. I totally disagree with Councillor Holm. I really commend the staff for doing this hybrid. I think it's going to work well, and I think it gives people an option. And I think I totally would go along with the hybrid.
Councillor Chapman?
Yeah, thank you, Your Worship. In reviewing the option 1, 2, and I was really happy to hear about option 3, which are this hybrid version, mainly because we have so many groups of people in our community who are obviously would fall under one of the two categories, and you'd hate to have at this time people who felt that they were turned away. And so the hybrid model to me kind of was sort of the more acceptable version that will bring into line so many of the different user groups that are involved here. So I would speak in favor. It seems from Russ's comments that other municipalities are implementing a hybrid version.
Councillor Avery?
Thank you. I would also be speaking in favor of option 1, which would be showing proof of vaccine or a negative swab. We can see what the rates are in our hospitals. I work in it every day. It is real. COVID is real. We've got to stop trying to maneuver around and think that it's not something that is here and something that's happening. I believe yesterday 20 people in our province passed away from COVID, and are we in the way? And if we take option 2 or 3, we're just in the way of trying to eliminate the spread of this virus. It's something that we need to take a stance on. We can't just pussyfoot around like we're always talking about what's the provincial government doing, what's the federal government doing. Are we the government for the town of Coaldale, or are we the government for Alberta? We got to start taking a stance on some of this stuff. And here we are again. We're just going to take a soft hand, a coddle approach to something. Are we in or in the way? Option 2 and 3, we're just in the way. We're wasting our time having this meeting. Option 1 is we are trying to help assist with the elimination of this virus. That is true. That is real. Our hospital systems are breaking. As we speak, they're looking at moving patients to Ontario. And we just want to have a soft approach, and we'll see what the user groups are going to do. And we'll go with a hybrid model. Are we here or are we not? Thank you.
Just in light.
Councillor Paul? Councillor Paul, go ahead.
I would do number 1 for the same reason as everybody else. And I have to go to the doctor. So that's my vote, please. Thank you.
I didn't quite get all your comment.
Okay, I have to go to the doctor, and when it comes to the vote, I vote for number 1. All right, is that going to work for you?
Okay, yeah, well, can we have a motion then?
I make a motion. Motion.
Councillor Pauls moves for option number 1.
Yep.
Okay, any discussion? No, I'm gonna, I think that I'm gonna vote against, because I think the staff,
That's
the
fine.
staff is working with the restrictions that the government's imposing and working in that, but, I think, working with the user groups and let the people that fall within the certain segments is the best solution, but anyway, anybody else? Okay, Councillor Chapman?
Yeah, thank you, Worship. The hybrid model will already incorporate portions of the, or maybe even all of exemption 1. I think that Russ, do you have some movement on that as to how you would process that? And also what I guess I don't want to throw money in as probably the caveat for voting against it, but maybe there might be some realities along with option number 1.
Go ahead, Russ.
Oh, my mute is acting up a little bit. Sorry. Yeah, no, just to kind of address what Councillor Chapman had mentioned, like the hybrid option is still going to ensure and enforce that people are following the government regulations, because there are 2 options for sure. I guess the only thing I would point out is to this group is that the user groups and participants that will be booking the ice, their feedback, and I'm sure you have waded in, but I just want to make sure that I didn't mull over it too quickly here and make sure that you're here. And they feel like they're already struggling with participation based upon what the last year and a half looked like coming back to hockey. They're very concerned that if we went with the option 1 imposed upon them, that their participation numbers would be down. I know that's just one factor in so many different ways of deciding what's going on, but I just want to make sure that, because I told them that I would voice that concern, that was voiced to council, that they'd be really concerned at a 30% drop and already a major drop in participation. So,
Okay, Councillor White?
Not being able to have activity. I think this is the best way to combat this disease, is for people to get out and get some exercise and get some fresh air. The number of people that have been affected by COVID under 30 is very, very limited. And I think we're punishing our poor young people. Their parents are taking a stand. They don't want the vaccine, and the poor children have to suffer. They can't go out and be with their friends. I think I'm totally opposed to number 1. I can't imagine us as a small community going there. We really need to stand up for our children, and I really would let us try for a while. Let us try the option, and if that doesn't work, we can always go back. But let's give the kids a chance.
Okay, Councillor Holm?
Thank you, Worship. And Councillor Lloyd, if you want to get your kids to get the vaccine, let's kill this virus. Let's put this virus to the side. I personally don't need to have a bunch of people in our community running around continuing to spread this to others and killing off our community or putting them in the hospital. That to me is completely unreasonable thinking, that we would say, well, we don't really care about older people catching this disease from a younger person or anything else. So I think that is completely irresponsible. And to not vote in favor of saying, let's try and take control of this situation, I believe is wrong.
Okay, so we have a motion by Councillor Pauls, on the floor, so I'll call the question. All in favor? Okay, Counselor Holm is in favor, and Counselor Avery, are you on the call still? And Counselor Avery is in favor? Okay, and then opposed? Okay. That's defeated. Counselor Pauls, I don't believe is, unless Counselor Pauls is still on the call.
Can you state who is opposed? Because I can't see everybody.
Counselor Chapman, myself, and Counselor Lloyd, and then, so Counselor Pauls, unfortunately, I think has left the call. Lana, do you know if he's left the call or?
He didn't say goodbye, but he did notify ahead of time that he did have another appointment at 10:45 and that he would have to exit the meeting at 10:30.
So that with him exiting before the vote, and the vote is lost, otherwise it would have been tie and would have lost anyway, I guess. Okay, Counselor Lloyd,
Can I make a motion to accept the hybrid option?
Counselor Lloyd moves option number 3, I guess, or the hybrid option as presented. And any discussion?
Just,
Counselor Chapman?
I just want to ensure clarity on the hybrid model again, that
Vote for it.
in light of the circumstances, as Councillor Avery has pointed out with great clarity, is if we have to tighten down our belt, tighten things even more over the next weeks, that we might have to review this again, would we not, Russ? And I don't want it to be the alarm clock, but you know, we need to be prepared.
Yeah, great question. Through the chair to Councillor Chapman. We can review it on whatever sequence council would like. What I can tell you is that staff are expected to enforce these rules on an ongoing basis and provided with the support and backup they need. And if we feel there's additional resources needed there, that we'll certainly find a way to make it happen. It didn't just fall on deaf ears, the concerns of some of the loopholes and things like that. We've dealt with some in the past, but I can also tell you that our minor hockey president is one of the individuals that is the quickest to make me and my staff aware of where parents and other users are abusing what's expected of them, because he's very much of the opinion that they could ruin it for everybody. And so we work very closely with our user groups, and I've been really impressed with they've put their right foot forward in these restrictions in the past. I don't foresee there being any difference as we move forward here.
Very good, thank you, because I think what Mayor said earlier is that we need to take this, regardless of which model is out there, we have to take everything very, very seriously. And I know council is somewhat divided on which options, but you and your staff will want to ensure that for your safety and of course for the public safety, regardless of what age we're dealing with, whether they're 12 to 17s or adult age, I think everybody has to be kept safe.
Okay, so we have a motion by Councillor Lloyd for the hybrid option. And is there any other discussion? Yeah, I'll call the question. All in favor? Okay. And so that's myself, Councillor Chapman, and Councillor Lloyd in favor, and opposed. Councillor Avery and Councillor Holm. So the motion's carried for adoption of hybrid number 3. And then I'll entertain a motion for adjournment then. Councillor Avery, all in favor?
Before we adjourn, can we get a copy of what option 3 is? Because that's not part of our package. So to have that quick look, I just need to be sure exactly what is going to be implemented. So if I'm asked, how it's going to look.
Sure, Russ, can you email that, that page with option, the hybrid option out to everybody?
Yes, I'll do that right away. You bet.
Okay.
Thank you. And now I'll make a motion to adjourn.
Okay, all in favor? Okay, okay, that's carried. Thank you very much, everybody. Have a good weekend.